greater response in regards to tackling the burden of hepatitis. According to statistics by the World Health Organization, as at 2022, 304 million people are living with chronic viral hepatitis B and C. And also the same figure, the statistics indicates that 1.3 million people died of chronic hepatitis B and C as our statistics of 2022. The burden is huge. Nigeria is not insulated from the burden of hepatitis. What are the measures that can be taken to mitigate this high-risk disease that is ranked as one of the deadliest, one of the killer diseases that is ravaging the world? These are the issues we shall try to find answers to on this edition of Perspectives. As the day was observed July 28th yesterday, we'll focus on it today in the light of sensitization and raising international awareness on the subject matter. To lead the discussion, I have been joined by two panelists on this edition. First is a professor of medicine and gastroenterology, a pioneer chief medical director of the Benue State University Teaching Hospital. He is a member of the Technical Working Group on Hepatitis in Nigeria. Professor Abraham Malu, OON, is our guest on Perspectives this morning. Welcome to Agate Radio, Prof.
Thank you. Good morning, listeners.
We also have a consultant community health physician who is a state program coordinator, a Benue State HIV and AIDS and viral hepatitis and STI control program in the Benue State Ministry of Health and Human Services, Dr. Gabriel Anefu. Welcome to Perspectives, Dr. Anefu.
Thank you so much, and good morning, listeners.
I am Nathaniel Nongu, welcoming you to this Monday edition of Perspectives. And if this is your first time tuning in, be informed that it is audience participatory. The program is broadcast from now to 11 a.m. And at 10 o'clock, we allow you to call in number 0814-335-9292, 0814-335-9292. You may also send us a text message or a chat on WhatsApp to 0912-699-9404, 0912-699-9404. Log on to our website on www.agetradiotv.com to listen to this program. Also, you can download the Agate Radio and TV app from Google Play Store, a one-stop app that once you have Agate News, which is a newspaper, and of course, you watch live the TV programs on that same app. It's one-stop app that serves all these three purposes. You can also access the listenership of Agate Radio on Radio Garden. Once you have your Radio Garden app on any device at all, this program is streaming live on all our social media platforms on Facebook, YouTube, Instagram, X, formerly Twitter. We're available on all these platforms to serve you. Stay tuned. We'll go on a short break, and once we are back, our discussion here in the studio begins. Don't go away. We'll be back shortly. Thank you very much for being there, dear listener. I'd like to begin with you, Professor Malu. Yesterday, World Hepatitis Day, as observed across the world. What does this day entail in global and, of course, our national life, its national significance?
Hepatitis has been one of those unfortunately neglected diseases and concerns. But a few years ago, the WHO, after a lot of pressure from civil society groups and people living with hepatitis, included it on the list of those things that we should really try to address to reduce the suffering and burden in the whole world. But because information about hepatitis has been very scanty and most people don't know about it, the WHO decided to see how we can increase the awareness of hepatitis. And one of the most effective ways is to create a special day where we can have a lot of talk about hepatitis and try to inform people, to educate people so that they become very much aware of it. It has really helped in many countries, and even in Nigeria, people are becoming more and more aware of hepatitis because of the World Hepatitis Day. It's celebrated in the country all over, every aspect of it is celebrated. And I'm sure if you keep listening to radios and TVs in different states and across the country, you would have listened to one of the programs concerning hepatitis.
Okay, and that is why we're also here today. Dr. Anefu, also share your thoughts with us on what this day entails.
All right, thank you so much, Nathaniel. This day, just like Prof has said, it's very significant because we need to increase more awareness to viral hepatitis generally, particularly that of B and C, which is the one creating a lot of public health issues globally. And so the theme for this year, it's time for action. So because according to statistics from the World Health Organization, every 30 seconds a person dies from viral hepatitis related illness. So it is important that we accelerate response for better diagnosis, better prevention, diagnosis, and treatment for viral hepatitis to save more lives and also to better the health outcomes of people that are living with hepatitis. So that's why this day is very important, and that's why the theme for this year is also very important so that people can begin to take actions towards hepatitis.
Okay, Prof, for a lay person who may not be medically inclined, let us expand what the disease hepatitis means. What does it entail?
Hepatitis in simply terms simply means inflammation of the liver. Itis is a medical term that means inflammation, and hepa means the liver. So the liver gets inflamed. There are many things that can cause inflammation of the liver, but the most important ones are the viruses, 5 of them, and that cause this inflammation of the liver. The 3 of them will have it acutely, and either you die or you survive. Hardly do you die anyway. But the 2 of them, hepatitis B and C, they stay on for a long time to cause a lot of problem in the liver long term. And the liver continues to be inflamed and inflamed and inflamed. And you know, if you have a boil and that's an inflammation, and the boil heals, you leave a scar. In the same way, when the liver is inflamed, it heals. Even those that are healed leave scar, and that distorts the function of the liver. So hepatitis in simple terms simply means inflammation. It can be viruses, it can be bacteria, it can be drugs, it can be even food, it can be alcohol, and many other things can cause inflammation. But for now, we're addressing mainly hepatitis B and C.
Okay, and when you said it is liver inflammation, does it entail that it is purely a disease of the internal organs?
Yes, it can affect many organs in the body, but the most important effect is on the liver. The others are transient. It's the liver that the brunt of the injury is on the liver. All the other organs, internal organs, may be secondary affected because of its effect on the liver.
Okay, Dr. Anefu, would you like to add something to this?
Okay, just like Prof have said, in layman term, just like he said, hepatitis is just an injury to the liver. So that injury, it heals, leaves a scar, and then it continues. So there are a lot of things that, like he said, they are both infectious causes, those of things that can, and then those non-infectious causes like alcohol, some drugs, some toxins. Okay, so and the focus basically is on the viruses that affect majorly the liver. Just like he said, there's hepatitis A, there's hepatitis B, there's hepatitis C, there's hepatitis D, and then there's hepatitis E. Those 5 main group of viruses are the ones that create more problems to the liver. But the focus, just like he said, once you have hepatitis A, D, and E, usually there's recovery. So it doesn't, usually an acute condition doesn't leave so much injury on the liver. But once you have hepatitis B and C. Those are the ones that go beyond and create more problems and becomes chronic, just like you have read out the statistics of those that are living with chronic hepatitis B and C. So these are the ones that are of public health importance, and they are the ones that we are targeting in terms of focusing on its control or eradication. And so these are the ones that are basically of public health importance.
Okay, Prof, I am with you now. And going by the statistics of the World Health Organization, every 30 seconds, one person is dying of hepatitis-related illness. Speak to us about the burden of this illness, especially in Nigeria.
It's a very significant health problem in Nigeria. You know, the latest prevalence of HIV will be much, much lower than that of hepatitis in Nigeria. The latest study that we are relying on mainly showed that about 11% of Nigerians have hepatitis B, and about just over 1% of Nigerians have hepatitis C. When you calculate together based on our population, about 20 million people in Nigeria roughly have hepatitis. So it is very, very important problem. 20 million out of maybe we will say 200 million is just already close to 0.25%. So if you take Benue State, whatever it is, where we are now, it just means about more than a quarter of the people have hepatitis B or C. So it's a very, very significant problem. Worldwide, some other countries who had a very high prevalence is coming down because they're taking measures to try to control it. And in the near future, places like China, where it was very high, will become very low because of those measures. And that's why we need to address the situation in Nigeria, because about 20 million people suffering from a disease is very, very significant, and we have to address it.
Okay, Dr. Anefu, you are the state through program. Okay, help us understand the burden and prevalence of hepatitis, especially in Benue State.
All right, just like the professor have said, the statistics that we are relying on is that was conducted in the survey that was conducted in 2018, the National HIV/AIDS Indicator and Impact Survey. And so for the state, we have not had a state-specific survey. We just applied this particular prevalence to the population of Benue. And just like Prof has said, that over a quarter of Benue people are living with chronic hepatitis B and C. Because this survey that was conducted basically focused on these two viral hepatitis that are of public health importance.
Okay, Prof, you want to add something to that? Please go ahead, sir.
Yes, even though we're yet to do a comprehensive study in Benue State, hospital studies in the states have shown that it's quite high. And where I was here, I was able to do a study in the whole state covering the 3 senatorial districts, 2 local governments per senatorial district. And the figures more or less agreed with what it is on the nationwide level. So it is as high as the national statistics show.
Okay, and now let's talk about the risk factors. If it is high, what exactly are the risk factors for this condition, Prof?
The most important risk factor now we are concerned about is passage from mothers to the children at the time of birth, to their babies really, basically. So that's why it's so important. We'll talk about that maybe later on, where every pregnant woman should know whether they have it or not. So that if they have it, we can treat them and prevent them passing to their children. And that's why every child born in hospital should be vaccinated before they leave the hospital. And that's why every child born outside the hospital should be taken to the hospital within the first 24 hours to be vaccinated. Because the most important route of spread is mothers who have it passing it to their own children. Another factor that hastens the spread is one child passing it to another, particularly during nursery, primary school, and so forth. As they play together, they fall, they brace their knees, they brace their ankles, and so forth. And the blood from there can go from one child to another and cause infection. So these are the most important route. And these are extremely important because if your child gets it as a child, he has a 90% chance or 95% chance that this hepatitis will remain in their blood without being cleared, and it will cause liver problems later on. Address the question of mothers passing it to their children, and immunizing also the children who are below 5 years of age. We will reduce the burden of hepatitis. Unfortunately, we have injection safety in the rural areas and even in the towns where some quacks or inadequately trained medical personnel will get people blood contaminated from one person to another. That's an important route that we're addressing. And of course, people who inject themselves with drugs. There's sexual transmission, but sexual transmission is not the most important thing in Nigeria because more than 70% of people get it before they become sexually active. So it's people who get it earlier in life that are most important. That is not to say that sexual transmission is not important. If your partner, the person you are trying to get married, is negative, then of course you have to take measures of vaccination and so forth to prevent that transmission by that route. Blood that is not screened properly and then transfused from one person to another, particularly in rural areas, they just get the blood. Once it's compatible, they transmit, not knowing that giving disease from one person to another. I have an unfortunate relative who also got it as a child because of this blood transfusion that needed not be transfused. So avoid blood transfusion as much as possible unless it's properly screened or the reason for it is extremely important. That's when blood should be given, and then it must be properly screened. So mother to child, sexual transmission, blood and blood products, and so forth.
Okay, Dr. Anefu, one striking aspect of it is the mother-to-child transmission. And given the population of our rural communities, is there anything as a program coordinator for viral hepatitis you are doing with regards to sensitizing particularly rural women about the importance of chicken days so as to mitigate the chances of mother-to-child transmission?
All right, thank you so much. As a program, even nationally, the focus on viral hepatitis is very limited just until recent years. More focus is on HIV and AIDS as part of the program which I coordinate. So the funding has been not significant enough to pass this message across, even down to the hinterland. But we leverage on the HIV programs to maybe when we go out to talk to women in that regards about HIV, hepatitis, and then the sexually transmitted diseases. So basically, we utilize this day, the World Hepatitis Day, more because of issues of funding. We have not really established a robust viral hepatitis program in the States. We're only just leveraging on the HIV program to be able to provide these services to the Benue people. And it is only those who have the opportunity of coming for HIV services or those who test HIV positive that have the opportunity of being screened for hepatitis B. But however, since the program is not robust enough, women when they come for antenatal services, I'm aware that in the antenatal clinics, our colleagues have done remarkably well by providing this information and screening these women for hepatitis B and C, and taking a step further to also provide treatment for those who are positive and also educate them on the chances of transmission. And then immediately after birth, certain things that can be done, okay, that Aside from the vaccination, they also have like a booster, an immunoglobulin that they have to buy, because it's not free and it's quite expensive to get an immunoglobulin to give to the child. I think the last I'm aware of is about 60,000 naira. And so we as a program, we are hoping that soon we would have that robust funding. But I make bold to say that this present administration have, for the first time, allocated funds for viral hepatitis, which is what in the past years we have also tried to see how we can get funding from donor agencies and then from partner. But I say that we're happy that we have got some funding, and very soon we'll start a robust program that will go into the communities to enlighten people on the need to know their hepatitis status.
Okay, and that is why, as part of our corporate social responsibility, I Get Radio is already driving that process. Prof, you are a member of the Technical Working Group on Hepatitis in Nigeria. Speak to us about the level of sensitization, especially the vulnerable population of the pregnant women who you highlighted that stand a chance of mother-to-child transmission.
Thank you very much. Unfortunately, it's not where we would love it to be, but we're making progress gradually. There are many issues involved. There are a lot of ladies who get pregnant and don't even come for antenatal clinic. So it's difficult to reach them, but through community influencers and other people who are trying to develop enlightenment for these community influencers who will be able to reach these people and make them go to antenatal clinic. Even if they want to deliver at home, at least they should attend antenatal clinics, and as Dr. Anefu mentioned, they should be screened at that stage. Then even the medical personnel at the lower levels of healthcare, not all of them are very aware of hepatitis and what they should do when people have hepatitis. So we're working very hard on trying to enlighten that. We'll develop information materials and educating materials that we want to use it to educate all levels of healthcare, from the tertiary in the teaching hospitals. Even there is a lot of training needed, right down to the primary level, and at the community level as well, where even more training is needed. That's what the technical team is working on. And then, of course, as he mentioned, funding has been difficult, not just at the state level, but even at the federal government level. There's not much funding devoted to hepatitis. They have to leverage on other programs such as HIV or harm reduction, where there's a little more funding and so forth. So we're using all these venues to try to reach the pregnant women and make them. And then, of course, even at the facility level, there are some places where women deliver, and they don't have the vaccine available to give it to them. And sometimes very basic things, even in tertiary institutions in the towns, where the labor ward is in a different place, the vaccinating place is in a different place, and they don't work together closely the way they should work. So the woman delivers and they say, come back the next day or come back next week to the vaccination to be sure you'll be vaccinated, which it shouldn't be. Sometimes they say they don't have a fridge where they can preserve these vaccines in the labor ward. So it's as basic things that can easily be solved by just putting a fridge in the labor ward and storing the vaccine there and training the midwives and the nurses, so that once the child is delivered, the vaccine is given there even before they go. These are some of the things the technical team is working on to try to see how we can resolve it, because there are a lot of things that we can do with the resources we already have by simply reorganizing, training and reorienting the staff who are there on ground.
Isn't it disturbing that both of you have stated lack of funding, both at the state and the national level, and hepatitis is considered a burden? Is that not disturbing? Now, what efforts particularly should be channeled with regards to addressing this, Prof?
It's not just, surprisingly, it's not just in Nigeria. All over the world, HIV came and just took all the resources, all the attention, everything. It's not surprisingly because the Western world, where most of this money was coming from, were maybe possibly afraid of having a lot of HIV exported to their own country. So they wanted to address it where the HIV is. Hepatitis was neglected, even in the US, UK, everywhere. It is just a few years ago that WHO saw, we're addressing the HIV, but people are dying of hepatitis, that hepatitis came on board. And the STI and all this that he mentioned, hepatitis was just added later on in this last development plan that the WHO has drawn up. So we hope we will get there because awareness is being created more and more and more. So funding eventually may be able to come. But many WHO representatives in Nigeria have warned us not to be expecting very much from anywhere. Our countries, our states have to rise up to this. Before other funding agencies will see that we are really interested, then they will support us. But money is not going to come to the extent it came for HIV from outside. The states, the local governments, the government of Nigeria has to rise up to this before any other support will come in significant amount.
Okay, dear listener, if you are just tuning in, the program is Perspectives on Agate Radio 95.5 Star FM Makudi. We are discussing World Hepatitis Day, and leading the discussion here, I have with me a professor of medicine and gastroenterology, a pioneer chief medical director of the Benue State University Teaching Hospital, and a member of the Technical Working Group on Hepatitis in Nigeria, Professor Abraham Malu, officer of the Order of Niger, and a consultant community health physician who is a state program coordinator, Benue State HIV and AIDS Viral Hepatitis and Sexually Transmitted Infections Control Program, Benue State Ministry of Health and Human Services, Dr. Gabriel Anefu. You too can participate on the program later at 10 o'clock by calling in on 0814-335-9292, 0814-335-9292. Send us an SMS or a chat on WhatsApp. That line is already activated for messages. You can do so by reaching us on 08912-699-9404, 0912-699-9404. Log on to our website on www.agateradiotv.com to listen to the program. Also, go to Google Play Store and download the Agate Radio and TV app, which is one app that serves you for our Agate Radio. The Agate newspaper is there, as well as the TV platform. This program is also streaming live on all our social media pages on Facebook, YouTube, Instagram, X, formerly Twitter. If you have your Radio Garden app on any device at all, you can listen to Agate Radio from any part of the world, as well as that app which you can download from Google Play Store, as I mentioned earlier. These are the platforms for you to participate on the program if you're just joining in. Dr. Anefu, Agate Radio cares so much about the health of the people, and that is in line with our slogan of being the people's voice. Help us understand ways that people can actually go for hepatitis screening with regards to addressing its burden.
All right. According to statistics, just 1 out of 6 persons know that they have hepatitis. And so it's very important that you go and get tested. The testing for viral hepatitis just takes few minutes. It doesn't take so long, and it's available in all health facilities across the states, both private, public, faith-based. They also, at both primary healthcare levels, you have it's going. The screening for hepatitis, it's ongoing. The first step is to know your status by just visiting the nearest health facility to you, and then you just take the test. It doesn't take more than 10 to 15 minutes, maximum 20 minutes, you have your result. And then from there, you can take action. If you are positive, you'll be referred to facilities where you'll be treated. For now, treatment of viral hepatitis is basically at the level of the tertiary health institutions. the federal medical centers where you have the specialists, that's where, and then the teaching hospitals. So you have the specialist gastroenterologists, where Prof is a professor of gastroenterology, and we have the specialists in those areas. So for now, that's where the treatment, once at the primary or the secondary level you have that, you are referred. The only category of people that have opportunity of benefiting from that of hepatitis B treatment are those that have both HIV and hepatitis B co-infection, because the antiviral drugs that are used in managing the HIV clients also have is also used to treat those who have hepatitis B. It's just that of C that you would still need to go and get treated for. So it's a specialized form of treatment, so a good referral system is needed. So screening can be done anywhere, both at the primary healthcare level and then the secondary health level. It's the issue of the drugs, basically, that is the problem. And then you also need the specialist who will also examine you properly, look at, there are several investigations that are needed before you can commence treatment. And these are readily not available at our primary healthcare level or secondary healthcare level. So, but you have them in the tertiary healthcare level.
Okay, Prof, in terms of diagnosis, do we have the facilities, especially at the primary healthcare level, for proper diagnosis of hepatitis? And if detected, what could be done?
Yes, as Dr. Anefu already mentioned, it's so simple to test it. All you need is a finger prick on the little blood that comes from there, and the test on a test strip, you can detect whether you have hepatitis B or hepatitis C. So it's very easy to test. But to determine whether or not you need treatment, a few more things need to be done beyond that. We need to see how your liver is functioning. We need to see how much of that virus is in your blood. That's when you need to more tests to be done. Because it's not everyone who has hepatitis B who needs treatment. If the amount you have in your blood is so low, the amount of virus is so low, and also your liver is coping very well, you may not need treatment, because treatment is long-term. So we don't want to just start many people on treatment that they may not benefit from so much, because it's when the virus level in your blood is high that you stand a danger of coming down with a liver disease. So the first thing would be to find out really how much of that virus, but that is changing gradually. If your liver shows that the virus is attacking the liver, even without finding out how much of that virus is in your blood, where the WHO is recommending more and more that we begin to treat even those people. For hepatitis C also, we need to find out how much of it is in your blood, because about 15% or so of people who test positive with this test on the with finger prick turned out to be negative when we do the more detailed test. That's why to just start prescribing drug for hepatitis just because it's positive is not quite appropriate, because we're treating about 15% of people unnecessarily and it costs a lot of money to treat it. So it's better to at least spend a little more money to know whether you need to be treated or not. I know people get very anxious once they're told they have hepatitis. They want the treatment to be started now. But that treatment may be given, you may be spending money on it, and it may not benefit you very much. Thank God the reactions to the drugs is very minimal, so the drugs are quite safe. Then is treating with things like livolin, Slibon, and all of this, which they put multivitamins. That treatment may not be harmful, but it's not useful. So if you're giving you Slibon or livolin or any of these things, and then you think you are being treated for hepatitis, you are not really receiving treatment. You are just palliative that is given to you. Yes, as he said, the tertiary institutions are the most important ones. Here in Benue, we have 3 centers recognized by the federal government and a published directory of places where it's available at the teaching hospital and the Federal Medical Center and the adult specialist hospital. But what the technical group has recommended and we are doing is what they did for HIV. When HIV came, I was a very young doctor. We were treating it only in the teaching hospitals, but gradually it was shifted down to the general hospitals, and then even to the primary centers. That's what hepatitis, what the technical group is working on. So in the near future, like in some states, even Nasarawa State, is treating people at the secondary centers now because they were able to train a lot of people and let them know how they should treat it. So we hope that will come in Benue State also, where we train people at the secondary level and eventually even at the primary level, where they can treat, they can investigate and treat the basic hepatitis. It's those who have complications or have infection with HIV or something, which are more difficult to treat, then those ones will be referred to the tertiary institutions. Then the tertiary institution will have fewer people to treat and they will concentrate on those. But then the general hospitals and the primary health centers will be able to treat the bulk of the people. That's where gradually we are moving to. And with the funding, it should be able to train people who will do this treatment, even at the lower levels of cadre of healthcare.
Okay, Dr. Anefu, the strengths of hepatitis, which you pointed out earlier, hepatitis A, B, C, D, and E, are they vaccine preventable beyond getting to treat them, to manage, first of all?
All right, thank you so much. Those strains, the only strain that have vaccine for prevention is that of B, hepatitis B. That of C, there's no vaccine for C. A and D and E basically are self-limiting. So sometimes when you get them, you may not even know. It's an acute infection. Maybe you may just have body pains, body weakness, diarrhea, and all of that. Because their routes of transmission, it's also different. For that of A, it's through ingestion of contaminated food or water. That is fecal-oral route. And so most times they are self-limiting. It does not leave just within a few days to weeks. The body takes care of it. So usually there's no vaccine available for such. And then for that of D, usually D requires B for it to really function. So most times you find hepatitis D co-infection with that of B. So it does not have any significant effect when B is not available. So it's self-limiting. And that of E as well is also the same mode of transmission like A, fecal-oral, and then it's self-limiting. So, but the one of public health importance and where we are also focusing on is that of hepatitis B. And that's why Prof earlier mentioned that all children that are delivered in the hospital need to be vaccinated with hepatitis B vaccine before they leave the hospital. And that is the only vaccine that is included in our national program on immunization. So apart from the bed dose, you also have 3 other doses that are also embedded in our routine immunization. So starting from, apart from the dose which we also emphasize that you take within 24 hours, which is the bed dose, very important. You have other 3 doses, particularly for children. So you need 4 to be fully vaccinated for children. You also have vaccine for B, particularly for adults as well. So if you screen and you are negative, you also have opportunity to be vaccinated. So the schedule for vaccination for adults differs in different centers and settings. But for children, it is standardized and it's included in our routine immunization schedule. So it's only B that you have vaccine for.
Okay, and then C can only be treated if there is no vaccine for it. Once you are down with hepatitis C, no vaccine, it can only be treated. Is that what you are letting us know?
Yes, and the good news about C is that you can be treated and you can be cured.
Okay.
Yes.
But there is no vaccine for it, but it is curable.
It's curable.
Oh, Prof, is there something you want to add further to this with regards to the vaccine and management of hepatitis B and C in particular, which Dr. Anefu pointed out are of more public health importance?
Yeah, very little. The question you asked suggests that when you have the virus, you can still have vaccine. Whether it's B or C or anyone, you need the vaccine before you ever have the infection. Once you have the infection, whether it's B or C, vaccine doesn't help you in any way. So if you already have it, you don't need any vaccine because it doesn't help you. Because it's so common and it's so mild in infection that spending resources on it instead of putting it elsewhere is not very important. So it is those who visit our country from the Western world that usually get this vaccine before they come, because there it is not common. So if they come to get it here, it may be very severe on them, so they get the vaccine before they come. But for us here, even though the vaccine is available in other places, it's not economically public health approach worthwhile to procure that for vaccinating people. As individuals, if you want to get vaccinated because you are so much afraid of it, or you've grown up only in the best place in New Jersey or GRA, and you are afraid that you get infection in the rural areas, then you can get vaccinated.
All right. We'll go further, Prof. And this time, I'll request you to speak to us about if there are more categories of persons that are vulnerable to coming down with hepatitis infection beyond mother-to-child transmission.
Yes, there are many others. It was emphasized child to mother-to-child because that's the most important route to get. And people who have immunosuppressed, in other words, their body can't fight infection very well, can easily get hepatitis. And maybe because they have a cancer, and there are treatment with the steroids which suppress the ability to fight infection, or they are infected with HIV and the immunity is slightly reduced, all those can be predisposed to infection. Then those people who take risky behaviors, like injecting drugs, who inject drugs, sometimes they exchange needles among themselves, so blood from another person contaminates the other one. That was at increased risk of doing it. And of course, commercial sex workers, because they have many partners, even though hepatitis in Nigeria comes mainly at a younger age, there are still a few people who have never infected till they become adults. So through commercial sex work, they have a lot of partners, so they stand the risk of getting that infection. Then those who are multiply transfused, those who have a lot of need of blood, like sickle cell, children who their blood gets destroyed, so they're transfused over and over again, and there are some other blood diseases, what we call hemophilia or something, that they lose blood a lot, so they need to be transfused several times. These people are also predisposed to infection. Then people who live in communities, in enclosed settings, such as people in correctional centers, and there are some there's factors there that can predispose to infection, or people in boarding schools or schools for mentally challenged children, and all of those ones in closed settings, those ones also predisposed to getting the infection.
Okay. When you mention people in closed environments like boarding schools, some parents could shoot at that. Should we stop sending our kids to boarding schools? But could it be true what means of transmission in general? If there's no blood contact, would there be any transmission of hepatitis to someone?
For hepatitis B and C, blood and blood products are the most important route of transmission. Sexual transmission also occurs, and that can happen for people who never got it at an earlier stage in life. So sexual transmission is another important route of transmission. Apart from these two, of course, the route of HIV, we know is mother to child, we know is blood and blood products, and we know is sexual. Fortunately, if you know those for HIV, you have known those for hepatitis. The diseases that get transmitted.
Someone with hepatitis could transmit it through sweat. Is this a correct mode of transmission.
Thank you very much for bringing it up. I was trying to avoid it, but it's good you brought it out. So the chance of transmitting hepatitis by sweat may be 1 in a billion, maybe 1 in a billion, or 1 in a million at the best. So do not be afraid to play with somebody because they're sweaty. The virus shedding in that is unlikely to get you. The same thing with saliva. But that is positive. Then they start to keep her or him at an arm's length. I have a lot of that experience of people coming to me who have this house help who is this way, so want to get rid of him or her. There's no need for doing that. It's only when there are a very close contact, like sexually involved in one way or another, that is when it's a risk. Otherwise, you can have these people. And of course, if they have any injury and they have blood coming out, then that becomes a danger. Because hepatitis B doesn't die very easily. So if some places get contaminated, the hepatitis B may remain there for some time, and eventually some areas who has also a broken skin can get onto it and it will get into them. Without a broken skin, it's unlikely that hepatitis will get into you. And without that broken skin or discharges from sexual activity, you are unlikely to disseminate hepatitis in the environment. So a broken skin and of course secretions, particularly sexual secretions, are important places of dissemination and also of getting the virus. You can play with a family member who has hepatitis. You can eat together. You can sleep in the same bed even, but without getting hepatitis.
All right, thank you so much for educating us, because it has been there commonly. We get to hear it, and it's good that we put it in proper perspective for our listener to understand it properly. Dr. Anefu, what precautionary measures should people take to avoid coming down with hepatitis?
All right, thank you so much. If you look at the risk, the way hepatitis B and C is transmitted, so the prevention would usually become very easy. You made mention that that means we should not send our children to boarding school. You know, what Prof meant, you know, those enclosed settings, they share sharps. You know, sometimes you have razor blade, you say, please help me, let me cut my fingernails and all of that, because you don't have opportunity to go out and get some of these sharps. So when you share these sharps, you are easily at risk, because when you are cutting your nails, the chances of even having an injury and blood getting in contact with that sharp object, and you will still store it for reuse. So somebody else, and like he said, the hepatitis B can last even up to a week. Even in some literatures, I would say that it can last up to a week in a surface. So if you give somebody your sharps to share, nail cutters and all of that, the person is at risk. And so prevention generally would start, you know, for us in the public health approach, you start from basically the primordial preventions, which has to do with policies and documents, which the technical working group is also designing those policies to see what actions can be taken, what we can do as a government to prevent people even before they have that infection. Promotion talks and then health education, just like increasing this awareness that like we're discussing about hepatitis as public health issue now, getting people to know the routes of transmission and how they can protect themselves. And so during the health education, you tell people to not to share sharps particularly. You educate people on ensuring that when you go to the health facility, before, once they tell you that, oh, we'll need to give you blood, you need to emphasize that, yes, this blood need to be screened. Have you checked for this? So you as the patient, you need to also be aware so that you demand that these things be done so that the blood is safe before it can be transfused to that person. So you should also have a protected sex, okay? So using condoms correctly and consistently, you know, can protect against it. So and then vaccination, like we said, is also very, very important that you get vaccine, particularly for babies, like Prof earlier mentioned and we emphasize. So you need vaccines for prevention. And so those, and then also the secondary level of prevention, which we deal with early detection, and treatment. So if you don't know your status, you need to go and get tested so that you can be detected early, so that the injury to the liver can also be limited. Once you get tested and you are positive, you need further tests to also confirm whether you need treatment, early enough, or you don't need treatment at all. So it's important, because if you don't know your status, you will not be able to seek for care, And then also, you find people that come very late to the hospital with liver cancers, liver damage. So at those tertiary level of prevention, you are just managing those conditions so that complications don't arise as a result of those severe liver injuries that the person come with at those late stage. So basically, that's the way the prevention from the public health approach is supposed to happen.
Okay, Prof, just before we start responding to cause, speak to us about complications that could arise from chronic hepatitis.
The most important complications are what we call liver cirrhosis. The liver becomes scarred to the extent it cannot perform its duties well, and liver cancer, which is very difficult to handle. Unfortunately, you have to address hepatitis very early to prevent these complications. Most people who come down with it have lived with hepatitis for 20 years or more. So by the time they're coming, they're having symptoms and coming, it's usually very difficult to really treat them properly. So the complication of cirrhosis is because of the inflammation. As I mentioned earlier, when you have continuous swelling and inflammation, the healing leaves scars, and those scars distort the shape of the liver and the function of the liver and the blood flow in the liver. They also make the liver cells become less in number, so they are able to perform their functions as well as they should do. They can produce the type of proteins that we need to keep your body working healthily. So because of this lack of protein, the body cannot handle water very well, and so they come with swollen tummy, swollen legs, and so forth, because the liver is no longer performing its duties optimally. And eventually, because of the lack of proper blood flow, blood may accumulate and try to go different ways. Just as when a gutter is blocked, you see the water flow after rain will divert to all sorts of places and will produce erosion and so forth. In the same way, when the liver cannot perform its functions very well, the blood is diverted to places where it shouldn't go, and they start vomiting blood or passing it at the lower end and so forth. Then, of course, if this is not addressed in time, they can go on to develop liver cancer. In hepatitis B, even without the cirrhosis, even without the distorted liver, it can develop liver cancer, because the virus gets included in your own cells that multiply. So in the process of trying, your cells are continuously regenerating and dividing. In the course of dividing, they will develop cells that go out of control, and that's what we call cancer. Hepatitis C can also lead to liver damage and eventually liver cancer. So people come in with yellow eyes, swollen legs, swollen tummy, vomiting blood, or sometimes are able to make urine adequately because the kidney now gets secondarily affected and so forth. So these are the complications, and by the time they come at this level, it's really very difficult to handle it. So the thing is, as Dr. Anefu said, that know your status and get treated if necessary early in life to prevent these complications arising.
All right, it's about time now for us to engage with the listener, and the line to call in on is 0814-335-9292. 0814-335-9292. Send us an SMS to 0912-699-9404. Please include your name and where you are sending your message from. Good morning.
Yes, hello, good morning, Nathaniel.
Good morning to you. Welcome to Perspectives.
Yes, Ibrahim is calling from high level at the moment.
All right, good to have you on the program.
Yes, I want Prof to throw more light. It is common for people to share clippers and cutting tools. It's a common practice. So what kind of heat should the barber use, or should the person cutting nails to use in sterilizing those sharp objects? Because we often see them using just a lighter and flashlighter on it. So is that a good practice, or what should be done? Thank you.
All right, Bidutenenge, thank you for calling in. Could that be all from you? Okay. Thank you, Bidutenenge. We'll respond to your question as we go along. He is asking ways of sterilizing equipment, especially he mentioned barbers in particular that they use lighter. We'll come to that. Hello, good morning.
Hello, good morning.
Thank you for calling in.
My name is Pius.
Pius who?
Yeah, Pius Ani.
Okay, Pius
I'm
Ani.
calling. Yes. Please, I want to know how can one get to, or is it possible to know if one had done the vaccine when he was much early, in childhood, and there's no record to show, and one want to confirm, can that be tested to know whether one has had the vaccination earlier?
Okay, Pius, where are you calling from, please?
I'm calling from Adoka.
Okay, Adoka. All right. Once you call, please remember to tell us your full name and where you are calling in from so we can document properly. Hello, good morning.
Hello, good morning, sir.
Morning to you. Thank you for joining us.
My name is Gabriel Philip.
Okay.
I'm calling from a gun project.
All right, Gabriel Philip, go ahead. We're listening to you.
I was having an interaction with one of my friends. He said his colleague, his sibling had something of, it's only C that can be cured. B, it cannot be cured, then it can be treated and it will go to a certain stage. But once you stop taking the drugs, the reaction comes back faster, and when it comes back faster, it becomes something else. So what I was trying to say, he said the person has B. So he said the B was treated and cured. So I wanted to be confirmed from the prof and the doctors in the house. Is B being treated and cured? That is the question.
All right, thank you. Thank you, Philip. All right, you two may have your question to ask or a contribution to make. The discussants will definitely respond to you. Thank you, Philip. The line is still open. Good morning.
Good morning, sir.
Thank you for joining us.
Thank you. I am on that Gabriel from Madoka.
All right, on that Gabriel, go ahead.
My regards to the expert in the house. I'm in the game.
Thank you.
Because I was listening to them. But there's one thing, the hepatitis, this disease. It's not an ordinary thing to toy with, to play with. So what I want the government, our government, to do, both state and the federal government to do for the citizens, is to sit up and then have training of the experts. We have more doctors who are experts on this field, and more areas where centers can be created for the treatment of this disease. Because like the small children, they can't talk, they can't complain. It is only when they are tested. So if there are nobody to test them, how can they know that they are being affected by this disease? So what we want our government to do is to sit up and help the citizens, especially in the rural areas where all these things can happen the most.
All right.
We cannot have even treatment areas. So we want them to help us. Thank you.
Thank you, Gabriel. Thank you. Government should get weighed in by engaging more specialists in this area. That's what Andachi Gabriel is appealing. Good morning.
Hello, good morning.
Thank you for calling in. Please,
I'm Margaret from Makodi, Georgia Akume Road.
Margaret, could you move away from your radio set or turn down the volume so we hear you better?
All right, sir.
Okay, Margaret who?
Margaret, Tatia.
Okay, Margaret, good to have you join us.
Thank you. I want to commend your people, the doctors in the house.
Thank you.
They have really enlightened me on the issue of hepatitis. I want to ask a question. On the issue of vaccination, how long does this last on an individual's body?
Okay, could that be all from you?
Yes, thank you.
All right, thank you, Margaret Tajia, for calling in. We appreciate you. The line is still open, 0814-335-9292. We are noting the questions, and when we come to them, we'll respond at a go, so as to allow the conversation to flow better. Remember, we are discussing World Hepatitis Day, and leading the discussion, I have in the studio Professor of Medicine and Gastroenterology, Pioneer Chief Medical Director of the Benue State University Teaching Hospital, member of the Technical Working Group on Hepatitis in Nigeria, Professor Abraham Malu, as well as a consultant community health physician, state program coordinator, Benue State HIV/AIDS viral hepatitis and STI control program, Dr. Gabriel Anefu. Good morning.
Hello.
Good morning.
Good morning.
Welcome.
I'm Dr. Paul Abba.
Okay, good to have you join us, Dr. Paul Abba. Where are you calling in from?
I'm coming from Makadi, actually Benue State University Teaching Hospital.
All right, that's interesting.
I want to thank my Prof, who is the lead speaker today, Professor A.O. Malu. He was our pioneer CMD in district, and he did a lot for us. In fact, the treatment he started on hepatitis B along with Dr. Bekma is still helping us in Bisut.
Sir, may you move away from your radio set a bit or turn down its volume so we can hear you better?
Yes.
Okay, continue, please.
Okay, so as I was saying, he started the treatment here in Bisut, and a lot of people have benefited from it. By that time, we were sending our samples to a specialist hospital, Irua, for viral load and all that. But I want to thank God that right now, equipment are already arriving in the hospital that we'll use for the determination of the viral load, such that good, complete treatment can be carried out here in Bisut. So I really want to congratulate him for that work that he started here with Dr. Bekba way back 2012, and he's still helping us till today. My challenge is about the rural dwellers. When they were speaking, they spoke so much about blood transfusion and pregnant women and all that. My worry is that majority of these people live in the rural setting, and they don't have access to good testing for hepatitis B or C or any other one. And some of the women, when they are pregnant, they go to consult or access traditional birth attendants. They don't even go to the hospital, so they don't even get tested probably until the time that they are even delivered of their babies. So some of them that may be positive while they were pregnant, there is a chance of infecting their unborn baby with the hepatitis. And when these babies are born, they don't know the status of the baby, they don't know the status of the mother, and they take the baby for vaccination against hepatitis B. Sometimes that will mean even more harm for the baby, because it's already infected and you are still vaccinating the baby. Because as I know, vaccination is for only those who are not infected, to protect, aware of it, and they are vaccinating the baby. And also what I have observed in the rural settings, sometimes when we go out for inspection, is that because their feeding is low, most of the children are malnourished. And so they come down with anemia, needing urgent blood transfusion. So once they get to know the blood group of the baby and they get to know the blood group of the father or the brother, they just go ahead and bleed and begin to transfuse the baby with unscreened blood. So I am thinking and appealing too that laboratory services should also be expanded at the primary health care centers. If majority of people who are working there are not laboratory personnel, some of them are CHU, some of them are SLT, some of them are microbiology and others. These ones, they don't even know the storage condition of these kits, such that if the kits are available and they are not properly stored, they can give you wrong results because they are proteins and they denature with time. So what I am appealing to government is that they should recruit laboratory personnel, at least medical laboratory technicians and assistants, and transfer them to this primary health care center so they can carry out laboratory testing for all kinds of diseases. Thank you very much.
Thank you very much, Dr. Paul Abba, for sharing your insights with us. We appreciate you. All right. Let's attempt to respond to some of these questions before we engage with more people. We start with Igudu Denenge, who sought to know how barbers in particular, he mentioned barbers in the salon, how they can handle their clipper to avoid getting to infect people in case of any blood contact with the clipper. Treatment of a Dr. Anefu. I request you to speak on that briefly.
All right. Thank you so much. The standard process of sterilizing an instrument against hepatitis B or C and generally other infectious agents is what we call the autoclaving. You heat under hot air for a certain degree for like 30 minutes, more than 132 degrees Celsius for 30 minutes. However, for disinfecting surfaces, alcohol-based solutions can be used to disinfect surfaces that you cannot heat. So, the heating that I see the barbers do, for me, it doesn't look sufficient enough to heat this out. So, usually we'll say people should get their personal clippers or sharps or reusable so that you don't get to share with people, So, and I know that most people, because of that knowledge from the HIV aspects, they have their own clippers, which they also buy. I know that some barbers also have some form of sterilizing machines, which they keep it for a very long time, heat it. But I'm not too sure if that heat, because for medical apparel you need to autoclave for a very long time, minimum of 30 minutes. So for the lighter that they are using, if it's sufficient enough to kill that. But Prof will also add to that. But for me, what we encourage is that you get your personal clippers and sharps, which you use. And for those that can be disposable, you dispose them. So that the ones that you can reuse, like clippers, it need to be personalized.
Okay, Prof. Is there something you would like to add to that briefly? And then you also speak on the concern raised by Philip Yambe, who sought to know that a friend, he narrated a scenario that a friend or maybe a relative had come down with hepatitis B or C. I think he said C. And is it curable? Is hepatitis B and C curable? He sought to know that. Let's speak on the concern of Baba and then respond to Philip too, Prof.
Yes, I think he said it perfectly more than I can say it. I've been a communicator person.
Fine.
The only thing is that if you can't have your equipment, I will just insist that the barber burns that for a longer time, and the lighter, because lighter is like a flame, so I have the temperature should be very high, and if you burn it for a long time, I think it should kill the organism. I think to jump over one question of somebody say, how can he know whether he's been vaccinated or not in the past?
Okay, that's Pius Ani.
Yes. So yes, there are ways that you can test to know whether you've been vaccinated in the past. The most specific one is to take your blood and test what we call the immunoglobulins that show that your body has gotten the vaccination that you had in the past is still there and is effective. Crudely, we can measure, there are five proteins, 5 things that we measure about hepatitis B. And the initial test that they measure for you is just one of them called surface antigen. If we can find that you have antibodies to the surface antigen, in other words, the soldiers the body has produced against hepatitis, there's evidence that you've been vaccinated or you are immune. If we can get that and no other markers, only the soldiers fighting hepatitis, then we know you have been vaccinated before. And that's what we can know. Can hepatitis B be cured? For now, we are not sure. The drugs we have now are very effective in suppressing it and making it harmless in your body if you take them the way you should take them. But we don't know how long you should take them before stopping, because they are relatively new. They're only a few years back. So for now, we say just like for HIV, you treat indefinitely. If there are some markers that we can measure every 1 year or every 6 months, if we see those markers in your blood, we know you have been cured and we can stop the hepatitis B treatment. So for the majority of people now, hepatitis B treatment is long-term. But there are certain things we measure along the way that can let us know, yes, you now got immunity, we can safely stop the drugs. But unless we do those ones, we cannot just stop it and say you have been cured.
All right. So still on some of the concerns, Margaret Thatcher asked us how long the vaccination could last in the body.
In the past, we used to say every 10 years or so you should revaccinate yourself. Now the WHO and most of the research is showing that you don't even need to revaccinate every 10 years. Because this was because when the vaccines came, we didn't know how effective they will be. But monitoring those who were vaccinated much earlier along the years, beyond 10 years, has shown that if they were effective vaccination, they're still protected. So it is not mandatory now to get revaccinated every 10 years. Once you get vaccinated, as the previous questioner said, once we can show evidence that you are still protected, you don't need to revaccinate.
All right, so I hope you are listening and your concerns may be addressed. The line is still open, 0814-335-9292. Many people are trying. If you are not able to connect to the line, kindly send a text or a SMS to the line 0912-699-9404. Good morning and welcome to Perspectives. I'll come back to you shortly, Prof. Morning to you. The name is who?
My name is Geoffrey Bishe.
Geoffrey Bishe?
Yes, I'm calling from Bachangwe local government.
Okay, Geoffrey, you sound very distant from your phone. Could you speak up so we'll hear you better?
Okay, can you hear me now?
Very well. Go ahead, Geoffrey.
Okay, to me, let me start to say that if somebody is infected, and how can he get a way to have the vaccine? When you are not financial board enough.
Okay, Geoffrey, could that be all from you?
Yes, like me, as I'm speaking to you, I am in a village. So let me say so. So there is no road, access road for me to go out. For us to go out, it's time that we used to go out. So and there is no medical clinic in our place now.
Okay, Geoffrey, we have listened to you. The authorities are also listening, and we hope your issue will be addressed. Thank you. We'll allow the experts to maybe recommend a solution.
Okay, sir.
Thank you, Geoffrey.
Thank you.
All right. Prof, you were itching to say something before I responded to that caller.
Yes, it was about the beautiful comment Dr. Paul Abba mentioned.
Okay.
Some people who may be infected as babies and then get vaccinated. Thank God, as far as we know, vaccination is not harmful, even if you are infected. The only thing it is useless. So to be on the safe side, if we cannot test to know whether the person has infection already or not, it's better to vaccinate those babies who are born with women who are positive for hepatitis B. It's the best option would be to vaccinate them, because the worst will be that the vaccine is not useful, but it will not harm them because they already have an infection.
All right. Good morning.
Yes, good morning. If you could calling again.
Okay, Birutenenge, we actually allow our listener to call in once, but go ahead, just summarize briefly.
Yeah, actually, I want to ask. I'm a medical personnel also, and before we vaccinate some patients, did I say wrongly? Once a month for 3 months. I think there's a new procedure for vaccination. Please, I want the professor to give more light. Yes.
At a point, the network, maybe at your end or here at our end,
can you hear me now?
Was breaking. Could you take the question again so we'll hear you better?
Yeah, I said I'm a medical personnel, and I said at a point it vaccinated some patients wrongly, because I've heard that there is a new procedure. We're giving them one vaccine once every month for 3 months. Please, the Prof should throw more light. In such cases, what are we supposed to do to correct that anomaly?
Okay, you mean patients were vaccinated wrongly?
Yes, once a month for 3 months. That's how we were giving the vaccine.
Okay, thank you. We'll speak on that. We'll allow Prof to comment. Thank you. All right. Prof, before you comment, Dr. Anefu, you listen to Jeffrey Bishop from Bacan speak to us. You listen to him. I do not need to go all over. Talk to his concern and how he can find help.
All right. His concern is that his vaccine. For the person who is already infected, like Prof said, the vaccine is useless. But like we try to, enlighten people against some of the misconceptions that we have, that if you live with somebody that has hepatitis, you can become infected, or maybe when you share objects, sleep on the same bed and all of that. That's not the route of transmission. But for he himself, if he needs to get vaccinated, he needs to go and get tested first to know whether he's positive or he's negative. It is only those who are hepatitis B negative that can benefit from the vaccine. Yes, I understand that he's staying in a rural area. For the vaccination program, like we said, for our routine immunization, that's the National Program of Immunization, is only basically for babies. But adults can be vaccinated because the dose for the vaccine for adults is different from that of the child. And for now, the vaccination is accessible at epidemiology units opposite the BSU second gate for adults. I think the only is free, but I think they just pay for the needles or so, syringes that they use, but it's basically free for adults. So people who want to travel, who have not been vaccinated before, but you need to take the 3 doses of the vaccine, standard, from the time of contact, then 1 month or 4 weeks after the first dose, and then 5 or 6 months after that second dose that you have taken. So you need 3 doses as an adult to be fully immunized. So, but we get sometimes some people will take and then they are nowhere to be found again, so they don't complete it. But for you to have that long life protection that Prof is talking about, you must have completed your immunization schedule the way it has been scheduled.
All right, so Philip, I hope you have listened. Geoffrey, rather. Hello, good morning.
Hello, good morning.
Welcome to the program.
I'm the Hassan Hembe from Tulengo, Maroka, Government of Benue State.
Okay, good to have you join us.
I may have 2 questions to ask. One is that, what are the preventive drugs or foods that actually one has to take the victim of HIV, hepatitis? And another question is, for how long will one continue with the other dosage of the vaccine? That is, say you have completed the cycle, then how long will you continue with another one?
Okay. Hi, Senator Hembe. Thank you for your questions. I'm sure that's all from you. All right. Maybe Ed Hyacinth joined us in midway because we had talked about some of those. But as a refresher, Prof, I'll request you to address the concern by Tenengi Dudu, who talked about wrong vaccination. I wonder if medical expert or a medical person is admitting about wrong vaccination, the open what that portends. But you listen to him, so.
Yes, thank you. I think he has already addressed it really. He was talking about the schedule of vaccination. Some people give it times 0, that's the first one, and then 1 month later they give the second dose, and 1 month later they give the third dose. Yes, if somebody has already had that, there's no need to restarting another schedule of vaccination. Check whether their immunity is there. There's evidence of vaccination in their blood or not. If there's evidence that they have been vaccinated, you don't need to revaccinate them. But the correct schedule is just what he has said. The first vaccine, the first dose that is given to you, we take that as times 0. That's the first one. Then 1 month later on, you have the second dose. And then 5 months after the second dose, or 6 months after the beginning of the first one, you have the last dose of the third one. That's the standard schedule of vaccination. But if people have vaccinated every month, sometimes you're having a crash program to get it completed before somebody gets married or gets something. So if you've done that, you don't need to go back and repeat it. You can only check to see whether your immunity is protected or not. Oh, now the last person who asked, there are no foods that you can eat or drugs that you be taken to prevent hepatitis. We talked of the ways in which people get infected. Those are the ones you have to address. And the vaccine will already address that issue severally.
All right, so hi, Senator Hembe, just a refresher because as you go along with us, you will get to understand some of the issues better. Good morning.
Hello, good morning.
We apologize that we cannot continue if you don't move away from your radio set.
Yes, I can hear you loud and clear now.
All right. Good to have you join us on Perspectives.
Yeah, my name's Textron Tehidebeke.
Tehidebeke.
Textron, yes.
Okay, where are you calling us from, Tehidebeke?
Calling
You are
from High
still
Level.
close to your radio set.
Yeah, I'm calling from High Level.
Okay, Tehide, go ahead.
Yes. The question I want to, people should throw more light on it, and I want to understand is the vaccine you people are talking about. There is 3 doses. And those 3 doses, after taking them, how long would that last in your body, or is it forever? Or is half number of year that expire in your body before taking another doses? That's where I want to get clarification from you people. Thank you. You're welcome.
All right, Tehide, thank you. I appreciate you. We also talked about this, but Prof, a refresher. Just a refresher because
if you get effective vaccination and there's evidence that your body has developed the soldiers to fight hepatitis, you don't need to retake another one after 10 years. I know we taught in the past, we taught it, we disseminated the information that after 10 years you will need a booster dose or so forth. But the evidence is showing that if you get effectively vaccinated, it lasts in your blood, it lasts in your body forever.
All right, so I think that should serve for you, Tehidebeke, and every other person that may have a similar concern. Good morning and welcome to Perspectives. Hello, good morning.
Good morning, Mr. Nathaniel.
Thank you for calling in.
I want to appreciate the senior doctors in the studio there with you.
When?
Daniel from was here in Makodi.
Okay, Daniel.
I don't want to waste time because I just joined, but I know the topic. I want to just ask a question. I'm sorry whether somebody asked, but I just came married, but I just want to ask a question. They do tell us that before, when somebody showed this thing that they're talking about, they say you will not eat fresh meat. This hepatitis that does not eat fresh meat and red oil. So I don't know how true is it. Is it true that somebody is having hepatitis, you will not eat fresh meat, you will not eat anything like red oil? I want the Prof there to enlighten me more about that. Thank you. That's my question. Have a nice day, Nathaniel.
Thank you, Daniel, for calling in.
Thanks.
We have guests here, so when you are particular that you want the Prof to enlighten you, I will begin with Dr. Anefu. Dr. Anefu, you are the state program coordinator on this. Help us educate Daniel and other Benue people who may have concerns about diet for people living with the condition of hepatitis.
All right, thank you so much. There are no dietary restrictions for somebody that is infected with hepatitis B or C. I know that a lot of people have these misconceptions. I don't know where they got those informations from, but there are no dietary restrictions for somebody who lives. It's just at the terminal age, stage of the disease where the person is coming with complications. You know, in trying to manage the complications, we tell the patients to reduce intake of maybe proteins, you know, but it's not when you are infected, you don't have to eat any oil or meat or proteins. No, there are no dietary restrictions for somebody who is living with hepatitis B or C. It's just at the chronic stage where the person has liver failure, and then because of the stress on the liver, they'll tell you just to reduce the intake of proteins and maybe salt intakes and all of that. So I'm sure Prof will throw more light in that regard because he has vast experience in managing clients with end-stage liver disease.
Okay, so Prof,
thank you.
we request you to also chip a word on this.
I think that's a very important question he asked because we meet it almost every week. I meet just a person with that, and he has answered beautifully. Eat anything you want to eat apart from alcohol, because alcohol damages the liver. Hepatitis also damages the liver. That's the only food that you need to avoid, alcohol, in order not to accelerate the damage that hepatitis may cause to your liver. Otherwise, you can eat oil, you can eat fresh meat, you can eat eggs, take milk, eat anything. If somebody advises you not to eat, ask them to bring their own to you so that you can eat as well. Eat anything you want to eat apart from alcohol. It causes no harm. And even people, I know where the misconception comes from. Hepatitis is not the same as liver failure. So because we educated the people in the past that we minimize this thing because of liver failure, they translated that as any hepatitis leads to liver failure, so they will start to avoid it. That is not the situation. Eat anything you want to eat.
All right, no dietary restrictions. That is the punchline. Eat what you can eat. Eat anything that is healthy. And Prof wanted to say that even if the person complains, join, you should eat the person that join. Is that right? The number to call in on the program is 0814-335-9292, 0814-335-9292. Send us an SMS or a chat on WhatsApp to 0912-699-9404. We are dispelling the misconceptions about hepatitis as well. So if you may have a question, go ahead. Good morning.
Good morning, Mr. Nathaniel.
Thank you for joining us on Perspectives.
This is Paul.
Paul who?
Oh, yeah.
Okay, which part? Okay, Paul, go ahead.
Yes.
Hello, Paul. Hello, Paul. The network at your end is breaking. Maybe if you may change position a bit so we hear you better. Hello, Paul. Paul, are you there? You are on, but we can't hear you. Oh, it's unfortunate, Paul. We'll have to disconnect with you. The network is unfriendly at your end. We can hear you, but the line is still open for you to call back. Good morning.
Good morning, sir.
Thank you for calling in on Perspectives.
Thank you. My name is Mr. Jaros Otumala.
Okay, where
Hello?
you are on? Where are you reaching us from?
High level here.
Okay, Jairus, we are listening to you.
Yes, now it's a question. This is a situation where a couple, how the wife managed to get it, you don't know. But the husband did not get it. And they have a child. What is the chances of, can they get another child? Is it possible? Or generally, if a husband doesn't have, the wife have, can they have a child? And if yes, how are they going to do it?
Okay.
Or the husband have it, the wife does not have it, can they have a child? If yes, how are they going to do it?
Okay.
Thank you.
Thank you, Jairus. I appreciate you. Dr. Anefu, you are the state program coordinator on this. It is related to your job description directly. Speak to that concern raised by Jairus or Tumola.
All right. Thank you so much. We have gotten some of these misconceptions that people who have hepatitis should not get married to. We've seen marriage counselors, or during requirements for marriages, we've seen the clergies, request that people do certain tests, and then when the person comes out to be hepatitis B positive, they have concern in joining those couples, which is not ideal. There's no challenge. Somebody who is negative can get married with somebody who is positive. Like we said, the negative person, like Prof earlier mentioned, most of the infections are acquired during childhood. So adults that are infected, just 5% of them have a chance that it will be chronic. So, but with vaccination, for instance, if the wife or the husband is negative, the negative partner can take vaccines, and that will protect. And, unfortunately, most people find out accidentally that they are hepatitis B positive because they don't go to the hospital. It doesn't give you any concern. Chronic hepatitis, you are living with it. You may not even know. So, but when you visit the healthcare center and they say, okay, let's run a general checkup, and then the doctor just includes hepatitis. Sometimes people come and say, I want to run a general check. And then we include everything, and then the person finds out. So the person becomes worried and all of that. And like we said during the course of this program, some people who are hepatitis B positive may not even need treatment. Others may need treatment. So the only thing you need to do if you are positive is to go to the health center, to do further investigations to know whether you require treatment. And like we said, because the couple is getting married, and then the chances of transmission, because the major route is mother to child, that's where the focus is. So during pregnancy, the person needs to go for antenatal care. During antenatal, because you are positive, you would have told, even the test is requested as part of the test during the routine antenatal care. At first visit, it's included. So once they know, they would give you health education and all of that. And there's a booster. So you need to deliver at the health facility so that proper things need to be put in place. During the course of your ANC, they will tell you, during labor, come to the hospital, you may need to buy a booster. The health care, the doctor or the midwife, they will prescribe the booster for you so that you start preparing ahead of your delivery. And then immediately the child is given birth to, that booster, that immunoglobulin is given to the child. And then thereafter, the child is vaccinated. And then the child is protected. Is vaccinated that first dose, and then continue with the other doses of hepatitis within the routine immunization schedule with other vaccines. So the child is protected. So there's no harm that your wife or your spouse is hepatitis positive, it should not bring an issue or shouldn't bring a quarrel or shouldn't be a reason why you cannot be joined.
All right, so Jairus, I believe that elaborate response serves you. But Prof, if you wish to chip in a word on that as you are itching to do so, I will allow you. Very briefly.
Yes,
before we
he's
go to
given
other
a
issues.
beautiful answer because I meet these things so much in the hospital. And they break up marriages. And that's why I wanted to just emphasize the fact that your husband or your wife is positive and you are not does not mean they have been messing around, sleeping around. Because most hepatitis in Nigeria is gotten before people become sexually active. So you might have gotten, that person must have gotten it long ago, even before you got married. So don't start to accuse them or feel uncomfortable with them because they have it and you don't. That why does he have it, why does he have it and I don't have it? He must have been sleeping around with other people. That's not the issue. In most cases, that is not the issue. So just come and, as I said, we vaccinate the person who is negative. And the pregnant women, now because that immunoglobulins is very expensive and not quite affordable by many people, if you attend antenatal clinic from late second trimester of pregnancy, we start to give you the drugs for hepatitis. Those ones will suppress the virus in the mother to the extent that the time they give birth, the virus will be almost zero and cannot infect the baby, even without the immunoglobulins, if they cannot afford the immunoglobulin. If they can afford it, it's good. You give it that double protection. But if they can't, at least you can treat it from the third trimester of pregnancy, and the chances of passing it on to the baby becomes almost zero. Public health and availability to more people, that's what we are more and more recommending for people who cannot afford the immunoglobulins.
All right, so that is not just for Jairus, but every other person. All that we are saying here is that you get the right information, and that is why this program is specifically packaged by Agate Radio to bring you all that you need to know about hepatitis. The line is still open, a few more calls, and then we'll try to conclude. But let's take some few messages for coming in from our guest, from our listener. Hepatitis, being a serious disease of the liver, can be treated by test medicinal plants. The doctors haven't said so anyway. Medicinal plants and the staff nurse through vaccine. May we not have a shorter treatment of it? Good morning, comrades. No, we're not comrades. Isaac Otsua from EA. Okay, Isaac, thank you for EA in Goma. Thank you for your message, but we'll get to hear the doctor's side. You are not a doctor, so medicinal plants that you have brought in is totally out of it. Good day, everyone. I am Ganesin Kunle from High Level Makudi. My question is, does it mean that everybody has hepatitis, as there are so many types of hepatitis? Okay, Ganesin, thank you for your question. Okay, this one, there is no name to it, and quite unfortunate. It's a message, but we can't take it because there's no name to it. But I will begin. Let's take one more call. Oh, we lost a call already. Okay, Dr. Anefu. I was going to request you both to help us understand the place of curing hepatitis, especially as there are some allegations that it could be cured with herbal medicine, which is why I was dispelling a message which someone mentioned here, medicinal plants. Is there any place of unorthodox cure for hepatitis?
All right, thank you so much. We get these questions very commonly, and within our environment where these unorthodox practices or this alternative medicine treatment is available, herbs in our environment, we get these patients that live with hepatitis say, I visited this place and I've been given herbs and I've been cured. Well, there's no documented evidence that these herbal medications cure hepatitis. However, they even worsen the situation because they put more pressure on the liver that is already being attacked by this virus. So instead of helping, just like Prof said, that you can eat anything except alcohol. So because of the pressure that the alcohol will also put on the liver, it's the same thing that the herbal medications will put on the liver. It will put more pressure on the liver and it will fasten the liver damage. It's going to aid the virus to even damage the liver. So if you are supposed to develop maybe a liver cancer in the next 10 years, using such medications can even fasten it. Maybe in the next 5 years, you come down with liver cancer. So it's not advisable that you go for unorthodox medicine or traditional medicine or herbs. They are proven medications, orthodox medications that have worked and they have been documented. They are available for treatment. So you don't need to seek this alternative treatment. Thank you.
Okay, Prof.
Yes, I completely agree with him. And it's very sad that almost every week I get people who were treated traditionally and told they had been cured. And they now come in with end-stage liver disease when you cannot do anything or liver cancer. In fact, there was a time here where Benue people used to hire buses to go to one place in Jos. And I had so many of those people who were told they had been cured. After a short time, they vaccinated and been cured or so forth, who are now dying of liver cancers and liver cirrhosis, which is very unfortunate. I understand there's somebody here in the state right now also, I don't know exactly where, but around Boko, Buruku local government area, who is claiming to be curing people. And I'm having people come from there and die because they were told they had been cured. And they come. I'm almost crying as I speak because I see this so regularly of people who have been misled. So it's not just traditional medicine, as he said, but even quacks who are around claiming that they have cured these things. And when these people get very sick, they come and die, and they don't know about it. And it's because of the wrong misleading this thing. So please, don't let yourself be misled for this traditional person who has told you that they have cured it. Hepatitis B, for now, is not cured by any of these things. It's only hepatitis C, which has drugs that cure it. So go to where you'll be properly treated.
All right, so this information is for every one of you listening to this program. Educate someone close to you, and let that someone close to you educate another that there is no place for unorthodox cure for hepatitis, as the experts have rightly explained. Good morning, presenter and our guests in the house. I want to ask if there are existing centers that one can go to confirm if his vaccination is valid. Thank you. Hi, St. Tile from Akwehe. Dr. Anefu, is there any place for confirmation of vaccination being valid, as High St. Tile is asking us?
Yes, there are centers, and these confirmations are specialized. It's not available in all health facilities, but if you visit the Benue State University Teaching Hospital or the Federal Medical Center, and if you also visit a Dosi Specialist Hospital, you will get the required information, blood will be tested, and the required services to confirm whether you have been vaccinated.
All right, Prof. We are totally out of time now, and I'll request you to briefly speak the areas government can invest more with regards to addressing the burden of hepatitis in Nigeria and in Benue State, and that will be your concluding words.
Yes, because it's such an important issue, if the government will help us provide the resources for the Ministry of Health to really train people at different levels of healthcare in Nigeria, in Benue State, so that people in the general hospitals and those in the primary healthcare centers are aware of what they should do when they find somebody with hepatitis, and train them to the extent that at least every local government they will be able to have a treatment center where people can come and be treated and only refer the specialists, those who need special care, to the teaching hospital and so forth. It will be very, very helpful. The program of hepatitis may be hampered just because of resources being not available in almost over Nigeria. But I just want to say that Nasarawa State, just close to us here, is being quoted not just in Nigeria but worldwide as people who address the issue of hepatitis very much. I hope our government will do the same. Lagos has learned from them and is now doing it. The same with Taraba State is trying to do it now. So if our government will really address these issues, we in Benue State will really smile. We want our name also to be on the national map of those people who are addressing this issue.
All right, Dr. Anefu, your parting words.
All right.
In 60 seconds, please.
Okay, thank you so much. My parting word will be that it's time for you to take action, get tested, get treated, and get vaccinated. Thank you.
This is where we will leave it on today's edition of Perspectives. I appreciate our discussant, a professor of medicine and gastroenterology, a pioneer chief medical director, Benue State University Teaching Hospital, Makurdi, and a member of the Technical Working Group on Hepatitis in Nigeria, Professor Abraham Malu, officer of the Order of Niger, joined us here on Perspectives, and we are grateful to you, Prof, for sharing your valuable insights with us on Perspectives. Thank you very much for coming, sir.
Thank you.
The consultant community health physician, state program coordinator, Benue State HIV and AIDS, viral hepatitis and STI control program, Benue State Ministry of Health and Human Services, Dr. Gabriel Anefu. Thank you for coming on Perspectives.
Thank you so much, and thank you for the opportunity to enlighten Benue people.
Dear listener, thank you very much for your listenership for this program. We couldn't take all your calls and messages because the time we have it 2 hours, but when we sit here with the discussants, 2 hours seems like 20 minutes. We couldn't take all the calls. Bear with us. Join us again on Wednesday for another edition of Perspectives as we focus on another issue. I Get Radio, care about your health, stay safe, and have yourself a great week. Goodbye. I'll be with you on Wednesday. Bye-bye. My name is Nathaniel Nongu.